Dr. Jha, you have said that the beginning of the end is upon us. I wonder how much of that is threatened by the defiance that we're seeing from some state leaders over mask and distancing mandates.
Yeah, so first of all, thank you for having me on. It is not helpful. It is, as Dr. Fauci said, it is going to set us back. Now, of course, I'm pretty confident we're going to be able to continue vaccinating people, and we are going to get through this. And we'll get to May where things will be meaningfully better. The question is, how much additional unnecessary infections and deaths do we want to suffer because we're not willing to keep simple things like mask mandates in place? And of course, my answer is we shouldn't let people get infected and die unnecessarily. Let's keep those measures in for another probably 6 weeks or so before a lot more people are vaccinated and things really do get better.
Dr. Jha, it's hard to understand how that would be anything but anyone's answer. And to really illustrate this point, Dr. Fauci has urged us to look at other countries where complacency has slowed progress. Take a listen.
The issue is, if you look on the very far right of the slide, as Dr. Walensky has said, we are starting to plateau. I've blown that up in a little section, which is now sitting in the middle of the slide. That plateau is about 60 to 70,000 cases a day. When you have that much of viral activity in a plateau, it almost invariably means that you are at risk for another spike. Next slide. In fact, as the Washington Post reported yesterday, many countries in Europe have seen just that. They had a decrease in cases over a 6-week period. They plateaued, and now, over the past week, they saw an increase in cases by 9%, something we desperately want to avoid.
Dr. Jha, when we talk about those spikes, what do those spikes mean for our back to normal timeline? How much would it set us back?
Yeah, well, two things. I mean, first of all, each of those spikes is additional infected Americans, people who are going to get sick unnecessarily, people who are going to die unnecessarily. And anybody who gets infected today and dies in 3 or 4 weeks is somebody who would have gotten vaccinated in the next month or two. So that's the travesty of all of this, is we're so close to the finish line. And it is going to set us back. Like, I think we're looking towards a really pretty close to normal summer, a very, very good summer. But if we do things like what Texas is doing now, it will make that harder, and it will mean a lot more people will be infected and sick as we go into that summer.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.